Please mute your mics. We'll start our program. Today our program is about teenage suicide, a true tragedy. We'll start our program with prayers, and then we'll proceed with the program. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِّنَ الْخَوْفِ وَجَوْعٍ وَنَقْصٍ مِّنَ الْأَمْوَالِ وَالنَّفْسِ وَثَمَرَاتِ وَبَشِّرِ الصَّابِرِينَ. We shall certainly test you by afflicting you with fear, hunger, loss of properties and lives, and fruits. Give glad tidings then to those who remain patient. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Rabbi zidni ilma, Rabbi zidni ilma, Rabbi zidni ilma. Assalamu alaikum all participants and all of our brothers and sisters and our young audience that I see today who joined us to discuss this important topic. We are gathered today under the umbrella of AMWPA, which is American Muslim Women Physician Association, an organization that has been in the Dallas-Fort Worth area for a few years now. Our main goal is preventative healthcare for our community, and also Muslim women empowerment through education. As a part of this program, we've all gathered here today with a panel of pediatricians and psychiatrists, child and adolescent, to discuss this important topic that has been bothering us for quite some time, but has become more of an issue in the recent months. The purpose of today's meeting is to bring awareness towards the importance of mental health and well-being. With an increase in depression and suicidal death across the globe, it is imperative that we as a community educate ourselves to understand and identify the red flags that can be seen in a person who needs help. As parents, early on, we have to become involved in our child's physical and emotional needs. As early as 2 years, when they want to talk to us, when they seek our help. And this has to go on into early childhood, teenage years, and even longer. We have to look out at our friends. We have to ask our brothers. We have to ask our neighbors, how are they feeling? We could make a huge impact and have a pivotal role in someone's life. We not only have to speak to our children, but also have to learn how to listen. We have to know who are their friends, who are they going on after school with, what is going on in life, and keep a connection with them as their needs can change. They should always know that there's somebody in their corner who's there to help. There is a huge role for pediatricians to play, and there's who can guide parents, but parents have to be very aware to know who are their resources, who can they ask for help. The format of today's meeting is going to be a discussion by our panel, which comprises three pediatricians and 3 psychiatrists. And after discussion, we're going to open the floor for questions from you. We'd request that you keep your mics muted. You can text and ask questions, and you can direct them at specific doctors, or you can just have an open question and we can answer at the end. I'm going to start the program by asking Dr. Lubna Kamal, who is a pediatrician and has a lot of experience over the last few years. And she will tell you a little bit about how parents can help early on with guiding their children and help them in battling stress or anxiety. Dr. Lubna Kamal.
Assalamu alaikum. I am Dr. Lubna Kamal, and I have been in pediatric practice for more than 25 years. And I have seen patients from all ethnic backgrounds. We all have come from different countries with different cultures. I am also an immigrant parent like all of you. All these years in practice, I have felt there is a conflict of culture which impacts some kids more than others. As a result, some of our teenagers may struggle with reconciling their cultural and religious identity with American lifestyle. A Muslim American kid is different than an American kid because of different cultural and religious values. Those children who suffer from reconciling with their identity are under a lot of stress and they're looking for acceptance and love. They need our attention. Academic stress and identity crisis are two major stresses in the life of some of the teenagers. This stress often affects their school performance and may cause behavioral issues. Your pediatrician is the gatekeeper. He is the first to identify any problems in your child's physical and mental health. I, as a parent, understand it's upsetting to hear that your child is not doing good at school and has other issues also. Your child is a gift of God. We as parents take care of them and provide them all we can to raise healthy, well-rounded kids, whatever their potentials be. I would like to just quote a quick example over here. I have seen a kid about 15, 16 years of age. I had seen him since birth. He belonged to a well-settled, structured family household. Initially, he was doing great in school. He was involved in all the sports, was doing good in basketball and making good grades. One day, his father brought him to me when he was like 15, 16 years for a well-exam checkup. He was quiet. He had poor eye contact and wouldn't even look at me. I asked his dad if I could talk to him in the exam room alone, and I did talk to him. He almost had tears in his eyes, and he said he's struggling at school. He feels he can't do good in these subjects. He's had tutoring also, and he would like to change his subject. On asking, he told me he's afraid to talk to his dad. He can't talk to him, for his dad is going to think that he's a lazy kid. There are a lot of such real life examples. Important point was that this kid was not comfortable talking to his own dad. There was a communication barrier. This barrier has to be broken between the parents and the kids. And to break this barrier, you have to stay connected. Connected in a sense where your kid can come and talk to you anytime on any issue of his life. This is the connection we need these days. This connection is possible when you get involved in their lives as early as possible. The involvement starts in early years, onwards to middle school, high school, and all the way to college years. To build a strong relationship, you have to lay the foundation really early. As a parent, you should know their teacher, know their friends, go to the parent-teacher conference, ask open-ended questions about bullying and other things in school. Your child needs sometimes supervise social media. I'll repeat again, supervise social media. If you have a good connection, there is no place for privacy in your kid's life. Communication is one key factor which keeps you connected with your child. Parent is child's best advocate. I have been always saying this in my practice to all the kids I used to see, that parent is a child's best advocate. Your child is an individual. Communicate with them. It's basic human need to build strong relationships. Listen to them. Talk to them in depth. Know what's going on in their lives. Encourage them to express themselves so they are comfortable enough talking to you on all issues of life. Be calm, empathetic, and non-judgmental, please. Guide them to their potentials. Let them do what they are good in. There's an aptitude for everything. Encourage confidence-boosting activities. Teach them the real skills of life, how to handle rejections and failures in life. This helps build self-confidence. Give them the reassurance of your love, your support, and acceptance, all the way till college years. You can't let it go once they're in college. All these issues have a solution, and that's with open, effective communication. Thank you, Mariam. I'm done.
Thank you. Thank you so much, Dr. Lubna. So now we are going to ask Dr. Faryal Ghaffar, another pediatrician of the group, who is going to talk about the signs and symptoms of depression. In children, depression can present very different from what we assume adults do, and these can be very vague symptoms. So being on the lookout for these symptoms, which might not strike as depression, can be early signs of anxiety and depression. So we'll invite now Dr. Faryal Ghaffar to come and give us some advice.
Salam to everyone. I'm Faryal Ghaffar. I'm a pediatrician. I've been in practice for over 25 years. I'll briefly go over the symptoms of depression in children. It's natural for children like adults to go through emotional ups and downs. For some children, feeling blue for an extended period of time can be a sign of depression. If your child's mental health interferes with social activities, interferes with schoolwork, family life, it's time to get help. If a parent has any concerns about the mental health of a child, it's very important that they get medical help, they talk to the pediatrician. It's very common to see mild depression getting into major depression and then into suicidal thoughts and suicide. So it's very important as a parent and as a pediatrician to know the symptoms of depression. So I'll go over the common symptoms and then I'll go over the vague symptoms as well. So the common symptoms are having behavior problems at school, deterioration in grades. The grades are going down, the parents are concerned, changes in eating habits. Now the eating habits could be not eating or overeating. Most of the time I see that the patients come with a complaint that they have not been eating well for weeks and months. Feeling of sadness and hopelessness. They have negative thoughts. They think they are not going to pass their grades. They are a failure. They have made their family, they have looked down to their family, that they have been a failure. They have a lack of interest in fun activities. So the parents will come and tell me that the child used to love to play football or basketball, and now for the last 1 month, he doesn't want to participate in any of the sports activities. So that's also another sign of depression. Low energy level or tiredness. So parents will come and they'll tell me that the child has been sleeping fine, but he's still fatigued, he's tired. Most of the time they'll have sleeping issues. They will not be sleeping well, or it will take them forever to go to sleep. And there are some cases that I've seen that they'll be sleeping a lot. Mood changes such as irritability and negative thoughts, as I have mentioned. In addition to these common symptoms, I have seen children with vague symptoms of depression. Some of these are tiredness, stomachache, nausea, vomiting, recurrent headaches. And I'll give you a couple examples. I had a patient that came to me and the mother brought the child and told me that most likely this child has urinary tract infection. And when I asked why the mother was thinking that the child had urinary tract infection, she told me that the teachers are complaining that as soon as the class starts, he wants to go to the restroom every 15 minutes. When I interviewed the child, he looked very sad and depressed. So when I got more information, I found out that he had a school phobia. He was afraid of the teacher, and that's why he kept going to the restroom. So, the parents thought that he had a urinary tract infection, and this was a vague symptom that he kept going to the restroom, and it was in fact from depression. I had another child that I saw, in fact, 2 weeks ago, and the child came with stomach pain, and the stomach ache was worse when the mom will drop the child to the school. And the same thing, when I looked at the child had tears in the eyes, was quite sad. And this was just a 5-year-old, 5 or 6 year old. And when I questioned, I found out that he had school phobia. But I have seen this commonly, that anxiety, school phobia can lead to depression. And as I already mentioned, mild depression can quickly change into major depression, suicidal thoughts, and suicide. So it's very important for parents to know the symptoms and get professional help as soon as they can. Thank you.
Thank you very much, Dr. Faryal Ghaffar. Now, we are going to, this tells you basically what the parents see, and then after that, they get help with the pediatrician. So the pediatrician, you've discussed what you saw, and once the concern of depression or anxiety is there, the pediatrician will refer to a psychiatrist. The next person who's going to join our discussion is a very valued member. She's a child psychiatrist. Her name is Dr. Mehvish Afrina. She'll be giving her advice on how the diagnosis comes about and what are the treatments for depression in children.
Assalamu alaikum. My name is Mehvish Afrina, and just wanted to kind of, elaborate a little bit more on what Dr. Faryal just kind of mentioned, starting out with some statistics. Depression, suicide is the second most leading cause of death in ages of 10 to 34. So just think about it, second most leading cause, the first one being accidents and unintentional injuries. So more than 48,000 people between ages of 10 and 34 kill themselves in year 2020. So it's pretty common. It's very, a lot of people suffer from depression. So identifying depression in early years and seeking help and treating depression early on is going to be very important. So, some more signs by the time, most patients come to child psychiatrist, it's already the depression is mostly moderate to
Wait, I'd rather you not help me. No, I'll help you. No, please. It's important. I'm not trying to make you drop nothing. I'm not going to drop anything. You really don't trust me that much.
No, we cannot hear you. Can you fix your mic?
Please fix your mic, Mehvish. We cannot hear you.
Afrina,
And please, somebody has to mute their mic. It's causing disturbance. Mehvish, can you please fix your mic? We cannot hear you.
Can you hear me? Okay.
Now we can hear Dr. Afrina. There was some disturbance earlier.
Okay, is this better?
Your mics on mute, please. Audience.
I can't hear you guys for some reason.
I can hear you,
Okay,
Doctor.
hold on for a sec. Okay, is this better? I'm so sorry. Is this
Yes,
better?
we can hear you. We can hear you.
Yes, we can hear you.
Okay, all right.
Unmute,
Sorry about
please,
that. I don't know
besides.
if anything made sense, or do you want me to restart?
It did. You were
we
good.
fine.
You were good till a minute ago.
All
Go
right.
ahead.
So, loss of energy, social isolation, kind of really getting into social media, and isolation from family members. That's one thing to kind of watch out, that, kid who's been doing fine, the school grades are dropping, frequent isolation, just really kind of, not wanting to interact with family members. Wishes of death, self-harming, that really tells us that it's kind of getting on the severe side. So open communication, having that relationship early on with the parent, with the kids is really important, so that they can kind of confide in you, talk to you. Really important that you validate their feelings and make them feel like they're validated, without any, judgment or stigma there. One thing that I think is also important is that the comorbid conditions, just like Dr. Faryal had mentioned, anxiety leading to depression. A lot of times I see that untreated ADHD, because the kid has ADHD and it's not treated. I mean, that can lead to teenage depression too. So autism, one thing, autism, high functioning autism is another thing that, sometimes you feel like the kids is just a loner, completely immersed into social media, not wanting to hang out with anyone. Is there autism? Is there underlying autism or high functioning autism that needs to be diagnosed, and appropriate help needs to be kind of, initiated? So that's important. And substance abuse is another one that really we feel like our community is immune, but really it's not immune. A lot of the kids who are afraid and worried to talk to their parents are getting into substance abuse, trying to kind of self-treat their depression, anxiety. So screening these comorbid conditions and treating them appropriately, I think, is going to be very important. I think one thing that really is going to be, frankly, from my stand, I want it to be a take home, is that acknowledging that there is a problem, that the kid has depression, rather than being in denial that, oh, it's just a phase of life, it's teenage years, or, their company is bad. I think acknowledging that there's a problem and getting a help early on is the key. And the sooner the help we get, I think the better outcome it is. And then I think we as community, and it's going to be important that we as community really work very hard to kind of overcome this stigma of mental illness, that we need to really work hard on breaking this barrier, and really not kind of, naming, as lazy kids, or, kids who are just really, who are just not interested in doing the schoolwork. I think we need to kind of really overcome that stigma and just get these kids the help. And I think one last point before I conclude is that my request to all my physician friends out there, be it pediatricians, internal medicine doctors, sometimes we have families, and challenging families, who are not open to medication, who don't want their kids on antidepressant medicines because there's so much stigma out there about the side effects and that. I think we all need to sometimes meet the families where they are without any judgment, without any, and really kind of, if not medicine, then we can at least encourage them to get some therapy, some help, at least some beginning. I think that's going to be extremely important. So I leave it here. Thank you so much.
Thank you so much, Dr. Afrina. We are looking at your questions and we appreciate them. I'm hoping that as you're listening in to all the participants, you can get some answers from there, but we would love to answer your questions towards the end. I would really advise that if everyone besides the participant who's talking would be kind enough to mute their mic so there's no disturbance in the quality of voice that you're reaching. The next person who's going to be talking to you is going to be Dr. Humera Chowdhary. She's a child psychiatrist, practices in Plano, and she will be talking about treatment and the difficulties that are encountered with treatment of mental health issues. Dr. Humera Chowdhary.
Thank you, Mariam. Assalamu alaikum. I'm a child adolescent psychiatrist, board certified, and I have been practicing in DFW area for past more than 20 years. I really appreciate all the participants' effort, and I can see a lot of interest here. I want to talk about take it to the treatment level. Dr. Lubna did a great job setting the tone that pediatricians are the gateways to identify the problem. And Dr. Faryal and Dr. Afrina have mentioned beautifully what the symptoms are. I would like to point out a few things that come striking to me, that symptoms have been mentioned, but every child is different, every human is different. So even these symptoms can present differently in any children. So please pay attention to what they said, take home messages, any changes in the behaviors, any changes in the habits, grades dropping, any change in personality. So be very mindful. So once the pediatrician or primary care doctor identifies, they send them to us for treatment. The biggest treatment approaches we have is psychotherapy and then the medication. I want to talk about the medication. First of all, the take-home message is that depression is an illness. It is a medical illness. And what I see is there are a lot of resistance that parents do not want their child to be on the medication. Yes, psychotherapy, when I see children, they are all wanting psychotherapy. But I cannot stress enough that psychotherapy is not the only treatment for depression. It is in combination, it does a great job. Combination of medication and psychotherapy. When we have depression, what it is there is a chemical imbalance in your body. Like when I try to tell my patients that when you have diabetes, your lack of insulin in your body is causing diabetes. So to treat that, you take insulin. It is very similar to that during depression, our body does not make enough serotonin. So we need to take some medication to replace that chemical to be able to fight this depression and get you out of depression. However, there are reasons that can be psychosocial stressors, there could be family issues, there could be dynamics that could be helped by psychotherapy. The big challenge comes when the parents come to the psychiatrist, they already have this stigma in their mind that, why am I at a psychiatrist office? It's not an easy thing. So it becomes that please, I would request and urge that please go ask for the treatment. And then from my colleagues, our job is to destigmatize the mental illness, help parents understand how important it is to take the medication. Psychotropic medications have been around for many years. They have been being used. However, I feel they're underutilized just because of the stigma and the belief that these medications are not good, they're not safe, they will be addictive, my child will become dependent on these medications, my child will have to take these medications for the rest of their lives. I hear lots of different questions, but these medications do have benefit. They affect you because the problem becomes when the child is depressed, child is struggling with mental illness, like Dr. Afrina mentioned, it could be comorbid, maybe ADHD, maybe severe anxiety, maybe they have autism, but the presenting symptom is behavioral challenge. All these conditions could be treated by medication under supervision of a professional psychiatrist. They do have side effects. Even Tylenol and Advil have side effects. But do we take them? Yes, we do take them with supervision of our physicians. I would like to take it like when you have cancer, your treatment is chemotherapy. Does chemotherapy have side effects? Yes, it does have side effects. But do we go ahead and start the chemotherapy? Do we take all those treatments? Yes, because we want to get better. Please consider it just like that. Psychotropic medications are helpful. They are used in lower doses and then they're monitored. Sometimes I have a lot of children who take the medication for a couple of years and then they do get better, and then we can wean them off of medication successfully. We have to try the medication. I would like, the biggest challenge that I face is that many parents walk into my office with a big no, that they don't even want to hear the medication. So what I would say is to my colleagues and we as child psychiatrists, our job is very tough. We have to engage the family. We have to meet the family in the middle. I will use an example. I saw a 5-year-old in my office. Mother, father, grandmother, caretaker, they all are bringing the child because what we are wanting is well-being of this child. I did the full assessment. His behavior is disrupting the family life, disrupting the whole dynamics of the family. So there is a level. Sometimes we don't recommend medication, but sometimes we do. So when I recommended the medication, mother and father, grandmother, everybody's like, no, no, no. So I backed off. I gave them all the options. I told them that it might get better. Like studies have shown that sometimes serotonin level gets better, but it takes 1 year, 2 years. Body replenishes it over the years. However, there is a suffering for the whole family during that time, suffering for that child. That child cannot perform to the full of their performance capabilities during that time when they are sick. So this family, I gave them all the education and they left. Next year, they called me back and they wanted another appointment. And I asked them, I said, well, you never came back. They said, now we are ready. So sometimes this happens. So they came, they are still under my care. The child is doing wonderfully. So I would like to bring to the attention of community that medications do help in combination with psychotherapy. I also want to say there are a few challenges that I don't want to talk too much about medication. That will become like a lecture. I want to talk about what community is facing. What as community we are facing is when the patient comes to me, first they don't want to take the medication. Next thing, they go home, they try the medication, they have one side effect or the other, or their aunt tells them that don't take it. Their grandmother tells them don't take it. They stop taking the medication without consulting with me and without coming back to me. So I urge my patients, no matter what happens, please come back to me. Compliance is a big issue in our community, that they don't want to be compliant with the medication. Another challenge I see is that they go home, they start the medication, they are doing better, they never come back. When they hit in the crisis, 6 months later, there is a crisis, then they want to come to the doctor again. So psychotropic medication, psychiatric treatment, mental illness, we have to treat it just like any other illness. Diabetes, hypertension, heart disease, cancer, nobody wants those diseases either. So like my colleagues have mentioned already, that take that stigma out, take that feeling out that how can my child has this? How can my child suffer from depression? Anything can happen to anybody. Anybody can be diagnosed with any medical illness, and I cannot stress enough, consider depression and mental illness, medical illness, physical illness. It is an entity. It is not a weakness of your religious belief, weakness of your spiritual belief, weakness of connection to your higher powers. It's none of that. It is the disease that has to be diagnosed, that has to be treated. And believe me, with the proper treatment and compliance with medication, we see so much positive results that children do better, they excel, their grades start coming back. I have had parents who are reluctant to start the medicine. Once they start medication, a month or two later, literally, it's touching my heart that when they tell me, oh, doctor, I got my child back. Because what was happening with depression was the child was irritable, moody, agitated. Mom was saying something else, dad was something else. The whole family was disrupted. So once those symptoms are under control, the performance of the child is better, the family life is better. So the parents are so relieved. So another thing I want to mention is that biggest challenge for us parents have been, I don't want to go to any ethical background or any cultural background. I think when it comes to the child, all parents are very protective. They don't want to give them any kind of medication. They want to do herbal treatment. They want to do homeopathic treatment. They want to do some kind of meditation. But these are approved treatments and they have approved efficacy and benefit. So I want my community to be aware of their benefit and please urge and educate others. Like sometimes I have seen that one patient, I have a young girl who I treated. She's doing so much better. She's doing so wonderful that later on, her father came to me and he was asking me in a challenging way. He was like questioning. He was a very angry man. And he asked me, he said, doctor, I never believed in psychiatry, but what you have done to my daughter, I want to try you for myself. I'm like, how do you want to try me to yourself? He said, I have suffered from anger all my life and I don't believe in psychiatry. What can you do for me? So of course we have to go through the evaluation, do the treatment. He was very skeptical. He was very angry. The moment he would enter my office, everybody would be aware that this person has come. I would not make him wait. I would see him and he is doing so much better. He comes to his appointments regularly. He takes his medications. He takes my suggestion with respect and he is compliant with the treatment. So I think
Mute your mics besides please mute your mics besides the speaker. Please mute your mic so we can have good quality voice. Thank you.
So I would conclude here. And I think Dr. Mariam, thank you very much. I would give the mic back to you.
So much, Dr. Humera Chowdhary, a very thorough, take on the treatment and the difficulties that are having. I can vouch that for, out of the 3 psychiatrists here, 2 of them I have referred out, and that's quite a bit of a drive because I practice in Arlington. And I could not say, they were coming, as Dr. Faryal had mentioned, children as young as 11 and 12 who were coming with identity issues. And I referred them to Dr. Riaz, who's going to be the second one who's going to talk to us now. And Dr. Chowdhary, parents were very skeptical, but they were coming every month for abdominal pain and don't want to eat and moodiness. And it took quite a bit of time to get there. So I wanted to make sure I send them to the people I know who will be convincing them. And 3 years later, both of these children are happy, successful, the families are satisfied, and now they do believe that this works. So thank you so much, Dr. Chowdhary. And personally, and obviously today, I'm going to ask Dr. Sabeen Riaz, a child psychiatrist, the next one on our panel, who is going to tell us about the parent's role in having a child, in a child who is suffering from mental health disease and how they can help and navigate the system. Thank you, Dr. Riaz. Dr. Sabeen Riaz,
Can you hear me?
Yes.
So, Assalamu alaikum. Wanted to thank all the participants for this talk today. Thank you for joining. And thank you for giving us the opportunity to speak, on the behalf of AMWPA. I wanted to talk to you guys about the different kind of parenting styles, and I'm going to be very precise. And I just want to give a message to the community that different kind of parenting styles, they can lead to different kind of child development and hence the child outcome. So one that has been proven to be more effective is the one called the authoritative parenting. So what is an authoritative parenting and what qualities a parent should have? So if you want a healthy outcome, a more successful outcome for your child, you need to adapt some of these qualities of authoritative parenting style. And that includes what? I'm going to talk about it. So these parents are basically, they have high expectations for achievement, but at the same time, they are very affectionate. They are very supportive of their child. They have very clear rules and boundaries. These are the parents who encourage independence. These are the parents who communicate with their kids. These are the parents who communicate with their kids with the reasoning for their actions. So it's important to teach your kid values, to teach your kid goals, to teach your kids morals. And what is the outcome? The outcome is going to be a happy child. The outcome is going to be a child who's more content, a child who's more independent and active, a child who's more successful academically, a child who will have a good self-esteem, better social skills, and better mentally. A child with less depression, with less anxiety, with less suicidal ideations, and less alcohol and drug problems. So I conclude here, communicate with your kids, listen to them, have goals set up, and teach them values. Thank you, Dr. Mariam.
Thank you, Dr. Riaz. We have been getting very interesting questions at the bottom, and I'm hoping that some of them we were able to answer just through, through the topic that was discussed. So one question, and I'm going to refer this one to Dr. Mehvish Afrina. A question from Mr. Nadeem Saeed is, how do we know that it is not just hormones affecting at/after puberty, but rather than depression? Dr. Mehvish,
Yes.
this question is for you.
Okay.
How do we know that it is not just hormones affecting them after puberty, but rather depression?
I mean, I think all teenagers are moody and irritable, but I think if it's more than just teenage, if you're seeing that, as I said, we kind of outlined some of the things, right? I mean, isolation, self-harming, frequent crying spells. I mean, I think teenagers are moody. That's no brainer, but anything that's not normal. And pervasive. I mean, I think, emotional premenstrual dysphoria is one thing. I mean, but again, if it's consistent, if you're seeing that for more than 2 weeks, if it's getting to a point where it's more severe, it's affecting sleep, appetite, social issues, school performances, the kid has been kind of, isolating self. So I think you would see these kind of symptoms, which you wouldn't see with normal, just hormonal teenage years during what we see with the hormonal changes.
Okay, next question. This one I'm going to direct at Dr. Sabeen Riaz. It doesn't say who it's from, but it's, can you please speak about people that are high functioning but have depression?
Anyone can have depression, whether they're high functioning or whether they are low functioning. So the functionality has nothing to do with the depression. So what is depression? It's mostly an internal feeling, internal emotions. That's what is depression. And what is causing it? We all have discussed about it, just in this talk. It could be environmental factors. It could be genetic factors. It could be other situational factors. So all these are contributing. And an individual, you can be a physician or you can be a scientist or you can be anyone, but you can still have depression. So it's just a feeling, So we have to understand emotion, feeling, actions, they all connect, and that leads to a situation or, an expression of depression or expression of sadness or mood. So that's what it is. I hope I have answered the question. And if you have more, you can just type it in.
I will ask another question, and this one will direct at Dr. Humera Chowdhary. And I think you kind of touched it in when you were talking, but I'll let you elaborate on it a little bit more. This is from Hudayfa, and it says, can you discuss if there are natural alternatives to medications to help with depression? The concerns are valid with medication, but are there doctors or medical professionals who have maybe a holistic approach towards this diagnosis?
Yes, that's a very good question. I would add that yes, there are other approaches. Like I mentioned, that it's a body has its own healing mechanism also. However, it takes longer if you don't do anything. The most natural things, and I recommend it to all my patients on a daily basis. Exercise is the biggest thing that releases endorphins and indirectly that builds up serotonin. So that is a great antidepressant. I recommend some foods and some fruits which are rich in serotonin, like bananas, turkey, and walnuts. This is my biggest list, easiest to use. You can have a turkey sandwich, you can eat banana for lunch, you can put walnuts in your cereal. Those are really good. Like you have noticed maybe when on Thanksgiving you eat a lot of turkey, after that you do feel sleepy. That is the serotonin that you have eaten. But then at the end of the day, the question is how many bananas can you eat? How many walnuts can you eat? And how much exercise and how much turkey can you eat that can give you enough serotonin? Another question, I will take it, Mariam, with your permission. Another concept that I want to mention, that many parents come and they say they don't want to take any prescription medication, but they want to do over-the-counter supplements. I hear lots of names, ginkgo biloba, some of these names that I learned from my patients. So I am very big, and I would recommend to audience also that please don't do that. I do not have any research to support those. I'm not against anything. You can do whatever you want to. Multivitamins, B12, B6, B1, vitamin B, D, these are okay. Iron pills, these are okay. But when it comes to attention, concentration, mental health, and all these supplement, I have my own bias. I feel this is a marketing driven thing. So please be careful. What I feel is there is no recommendation. What is the dose in one tablet that you are taking of that supplement? So many patients ask me, doctor, I have been taking this supplement. Can I continue? And I hesitate. I don't know how much serotonin in that supplement, and I'm prescribing my prescription medication. How would I monitor the level of medication that you are taking? Thank you, Mariam.
I have another question, which is, it's almost a very sad question, I would say. It's from Zalaka to everyone. Why would a child self-harm? And I would open it to whoever would want to answer this question. Now we have to remember a child goes from 5 years to actually 17, 18. Why would a child self-harm?
I could take that question.
Yes.
There are multiple things behind that. And I'm going to just lay it out there. And my other colleagues are welcome to join in and step in. Honestly speaking, I have been practicing in 25 years. I have never seen children cutting this much, this commonly, this frequently, this badly that I'm noticing nowadays. Yes, cutting had some effect. Some children, they inflict pain. They used to say, I don't feel any emotion. I'm depressed. I feel too dull. I feel numb. So they started cutting to feel the pain. Then they kept doing it because there was no treatment done. So they became addictive to that behavior. So it became addictive behavior. So that is what we used to see. However, now with social media, with YouTube, all these things have become so prevalent that some of my patients are doing it because my friend was doing it. And they don't even know why they are doing it. Some of these children, I was kind of taken aback. Last week, I saw one young girl. She was seeing me because she had cut. And I asked her, I said, what were you trying to do? So she was trying to prove to her friend that cutting works. And the friend challenged her that do not cut. Guess what this 15-year-old did? She cut herself and she cut the friend also. So it's mind-boggling that what are these children doing? These are millennials. We have to think at their level. They are impulsive. They don't think. Their frontal lobes are not developed. They are very impulsive children. So we need to be more cautious to get them the help they need, to get them the treatment that they need, Sooner they start the treatment, better will be the outcome, more productive results we will see. Otherwise, they indulge into all these different and difficult and erratic behaviors, I call them. They already have this phase of life. Puberty is a very difficult, very challenging phase of life. We were once at that age and we remember it was difficult. However, I want to stress one thing. I think challenges were not this difficult. Our children are facing a whole different world. Their challenges are different, their difficulties are different, their stressors are different. There is cyberbullying, bullying has gone to a different level. Peer pressure has gone to a different level. Competition has gone to a different level. So we as parents have to think differently. We have to think about our children in a different way so that we can connect to them, we can empathize with them, we can let them talk to us, we can let them feel that we hear them. And I know I took it in a different tangent, Mariam, but I have one thought that with our children, if we keep our minds open, I think we learn every day. As a parent, I have learned so much from my children. They have taught me different lesson. Every other day, I have learned a different lesson. Even today, I asked my children, I said, what should I talk about? So one thing which I would convey to my audience and my friends would be that one unanimous thing I heard from all of them was that parents should be available to their child. They should not be judgmental. They should give the child the feeling that they are loved, and they should give the child feeling that they are hearing them, and they be empathic and not be judgmental and give them the confidence. I have heard from my colleagues, but I wanted to say it in a different way because this is coming from the children. So we should not bring our biases in as a barrier to the treatment. I think many times our challenge is that we as parents bring our own biases and put a stop or put obstacles between those treatments. I think children have made parents humble. I want to take another comment and then I will stop. That Bulle Shah has said, "Hor vi niwa ho." That means lay low, be humble. I think I would request to my community, this is time that we have to be more humble. No matter how religious, how good, how educated, how successful we are, when it comes to parenting, we have to go down to earth. We have to be at a level of our child. And that really pays off. I will end at that. Thank you, Mariam.
Very much. My next question is for, it is coming from, where did it go? It was basically for Dr. Lubna Kamal. And the question is, what can parents do as far as social, how has social distancing and being in school affected our children? Has there been more depression this year, you think, because of the children learning from home rather than attending school?
Yes, children are also like, all human beings, they are social animals, and they do enjoy around kids of their own age. They enjoy being around them in the group settings also. Going to school, they enjoy, they are with their peers. Friendship and staying close to kids is really very important. And yes, COVID, unfortunately, this year has affected a lot of kids. Also, these are their growing years, their developmental years. They need other kids their age around them. And parents, and I'm sure parents who are at home are doing their maximum, just try to simulate that they're doing a school at home. They can wear masks, give them some outdoor activities, some sunlight to go play outside with. It's kind of safe now, I think, with the distancing. But yes, being alone is not good. We're all social animals and kids are no exceptions, I would say.
My next question is from Mahmouda Shafi, and I will direct this at Dr. Mehvish. The question is, please, doctor, tell us about drug withdrawal effect.
I'm going to, when the medication is prescribed, it needs to be prescribed by the physician, under physician supervision, who's going to slowly taper the medication, increase the medication to an adequate dosage. And these medications, if you abruptly stop the medications, can have withdrawals. So if somebody's coming off of the medication, they need to be done, it needs to be done in a controlled setting, and it needs to be done under doctor's supervision. And most of these medications, as Dr. Chowdhary pointed out, 95% of the people, patients respond fairly well, tolerate them well. About 5% of them have side effects. So these medications are fairly well studied and well tolerated medications. So it needs to be done in a controlled setting. And I think there's a little bit negative press about antidepressant medicine. And I think it's important for me to point out, especially when it comes to FDA black box warning in teenagers. So all the antidepressant medicines have FDA black box warning of increased suicidality. So parents get confused and ask as to how can something that help with depression also make the suicide risk worse? So when this study was done, I'm going to just give you a gist of that study that concluded all the medications, among all the medications that were studied, Paxil was the one that had a significant spike in suicidality, and the black box label was slapped on all the antidepressant medicines out there for teenagers. What that did was that created a lot of negative press, and people were afraid to take these medications, and the suicide rate kind of, went up in teenagers. So I think, it needs to be done under supervision, coming back to the question again, but these are well tolerated and underutilized medications. I do want to add one more point. I'm currently doing a fellowship in integrative medicine, so holistic approach. Somebody had asked that question, and I see one more question about 5-HTP for sleep and depression. I would say that if you want to try 5-HTP over the counter for mild or mild depression, I think that's reasonable. But I've also seen a lot of people admitted for sedative overdone on supplements. They take 5-HTP and then somebody's and they take that. Be extremely careful. Even if you want a holistic approach, it needs to be done by somebody who's gone through that training and who knows what they're doing.
A question that I'm going to direct this one at Dr. Sabeen Riaz, and this one is about the recent incident that happened in Dallas. And parent asked, since a lot of children have learned about this incident, how should parents talk to their children about what happened?
I think that is such a great question. And the first thing, again, I would say is like, you have to talk with the children about the fears they have regarding these incidents. Yeah. So first of all, open up the discussion. Okay, ask the child, what do they think, what happened? And then, just have an open forum, explain them that the person was suffering from depression or some kind of mental illness, and then explain them that there is help available, and then tell them what problems they are facing, and then how can they help the child. So basically, it again comes to talking with your child, getting the maximum information, guiding your child, supporting your child, and then explaining them, and then normalizing things, and then telling them in case if they are going through some problem or they're having some kind of difficulties, what they can do. They can come to you. And then if you cannot help them, then they should be seeking other kind of helps, like from the specialist, from their pediatrician, from their psychiatrist, whoever is the responsible for the care.
Another question, and I would direct this at Dr. Faryal Ghaffar, please. This question is, how can we keep an eye on our children when it comes to social media exposure? How much can we control it, and how much should we control?
Yeah. So if you look at the guidelines of American Academy of Pediatrics, they said that the screen time should be no more than 1 to 2 hours a day. We know that most of the work that kids are now doing is on internet. So of course we are not counting those hours, for the homework that they do. in addition to that, it should be 1 to 2 hours. It should be a supervised. So if they are going on the internet, they are using social media, it has to be supervised by the parents. So you cannot stop the kids, social media is out there, that's part of life now. So you cannot tell the kids that they cannot use it, but it has to be supervised. So that's, and they shouldn't be spending too much time on it.
There's a message and say, please don't say my name. This is how you could cure depression. If you keep remembering Allah, you find true peace at your heart. That is absolutely true indeed. But I will let Dr. Mehvish make a comment on this one. So
I think we all have to agree with what you said. I think in Allah's remembrance, there is peace. But I think Dr. Yasir Khadi had kind of, recently done a seminar on this. And I think he kind of summed it up beautifully. And I think, if you have some time, listen to it, that, I don't really think we need to confuse taqwa with depression. I don't really think depression, people who are very religious, very pious, who's doing, remembering Allah all the time can also still get depressed. It's no different than diabetes, hypertension, having a strep throat. Depression is no different. It's chemical imbalance. We know that. So I think when we imply that, somebody's depressed because they don't remember Allah, I think it kind of, again, it stigmatizes that person. It kind of holds them back from getting the help. So I think it's a very kind of, it's a fine line. And I think we need to really look at depression as any other illness, be it a kidney disease or heart disease. It's no different. It's a chemical imbalance which can be treated.
There's another question, and I will say it to Dr. Lubna, Kamal. Does the unborn baby inherit depression from mom? Does the unborn baby inherit depression from mom?
There's no statistical research or studies done on it, but it has been seen more so in babies to a percentage of about, I would say, 10 to 20%.
That's because since the mom's depressed.
Not proven though. I don't know if you want to add something to it, Mariam.
No, and a lot of times I think there comes and it's kind of, it's not inherited in that sense. Right. You have some common qualities in families and family traits, but depression is not inherited.
Right.
A lot of times the thing is, lack of support can cover it or show it earlier. But at the same time, help is available. And again, when you, a lot of times as parents said, when are the red flags? Once you start seeing the red flags, before the red flags is you have a child who's born for, you support them, you give them the tools to be able to communicate, you give them also the goods to be able to say how they feel and express themselves and be heard. It's not only, I say there's a book called How to Talk So Kids Can Listen and How to Listen So Kids Can Talk. It's very important not to just talk. You also have to make sure your children can actually respond and know that they are being heard and understood. So not only, we have to, as parents, I feel we have to change our setting, that instead of giving them answers right away when they're in a very young age, because when they're 5 and 7, they want approval from their parents. As they get a little older, they want approval from their peers. As they get older, they want to fit in. But if you build their foundation, then confidence is going to be there. And then if they have any difficulties, they can come to you. They're able to express. You can be their advocates when they're young, and they can be their advocates themselves and be able to express and not be shamed for what they feel and to be able to seek help rather than get help.
I would say it's not inherited, but if there's a family history of depression, there are more chances in the child, but it's not inherited.
Mm-hmm. Another question that came was for, which is, I think relevant still is, and I will direct this one at Dr. Sabeen Riaz, is about what is your opinion about bipolar disorder and how high rate of, inheritance do you see?
Opinion about bipolar and inheritance. So talking about inheritance, yes, all these mental illnesses, they all have, inheritance component to it. So again, bipolar has a very high incidence of inheritance, and then the percentage, I don't remember on top of my head, but I think it was close to 2 to 4%. And the thing is that having said that, I didn't understand the second half of the question. What else do you want to know? So basically, if you're asking what is a bipolar illness, so I can tell you it's an illness which is again classified as having a mood disorder, and then it has different, criteria on the basis of which we diagnose it. So basically, these patients, they will have mood swings, they will have irritability, lot of anger, lot of racing thoughts. They will have a lot of flight of ideas. They will indulge themselves in a lot of high-risk activities. And that high-risk activities could be anything, could be drugs, could be gambling, could be overspending and stuff like that. So they have lots of energy and they think highly of themselves. So if there is it has a very, very strong predisposition. If a parent is bipolar, then you can have the same illness in the child.
20 लोग हैं टोटल.
Yes, Mariam.
Mariam कहाँ गई?
We cannot hear you, Mariam.
Sorry, another question is, does it impact the child if one parent has depression?
Yes, it can. Again, it again goes to the to the causation of depression, and like we all have talked about it, that it can be environmental causes or it can be also the hereditary causes. So if one parent has it, yes, the child can have it, and how severe it will, it determines by a lot of factors which which influence, and they can lead to different severity in kids or in other kids.
Right. I would like to add to that is because, we as pediatricians, as this is pretty standard, is that a mother's depression or a parent's father's depression can impact a child, not because of just inheritance, but a mother who's depressed and is not on treatment is not at her best. For any mother, if she's sick, if it would be chronic kidney disease or anything that would ail her, she would not be at her best to be able to cater emotionally and physically to a child. So when a mother comes after giving birth, it's very standard to ask them about how they're feeling and are they in postpartum depression, because it is absolutely important for both a mother and a father to be mentally, physically healthy, to be able to cater to their child's emotional and physical needs. So depression, again, at the same time, is like it's not a taboo. It should not be taken as a taboo, but as a treatable disease. And it does affect not only depression, not only affects the person who is suffering from it, but from every loved one that is affected, the people who live with them, whether they're younger than them or older, their friends and co-workers. So it is important for all of us as not only physicians, but as friends and siblings to identify and know about depression. So when you see someone who needs help, we are able to guide them and get them the help if they are not aware of what their need might be.
I would just like to add, Mariam, if one person in the family is depressed and is not under treatment, it really disrupts the whole family.
And
Like
other thing, remember, is sometimes depression does not come alone. I mean, depression can be present as, a child can have anxiety, or they can have bipolar illness, or they can have psychosis, and then they're also depressed. So there could be a comorbid diagnosis. Kids with ADHD, they can also present with depression. So remember, it is better when your child is experiencing all these problems to take them to a specialist and have them evaluate the child and find out, okay, what are the different factors that are contributing to depression. Like many times if I see in practice is like, okay, the moms, they will have anxiety disorders, and they're bringing the kids, and the kids, they may have the same problem. So it is not like the mom has it, so the child have to have it. But the thing is, some of these traits, they get the inheritance, and then some, the environmental, and the way, again, how you raise your parents. If the mom is anxious, of course, she's gonna, transfer that anxiety to the child. So there was a question that I was reading, and it was saying if the depression is contagious. So answer is no, it's not contagious, but yes, parents are depressed, and the kind of, like Dr. Lubna has said, if one person is depressed in the family, and then the other persons, they have to deal with it, of course, there will be some influence, but it is not contagious.
I have my next question, which I'm going to direct at Dr. Faryal Ghaffar. And the question is, do video games cause depression?
Video games have not shown to cause depression, but if the kids are playing video game all day long and they are not participating in other activities, then it's going to be a problem. But I will ask one of the psychiatrists to, talk about.
Lot of the ADHD kids that we see, they spend a lot of time playing these video games. And in those kids, the normal mental health diagnosis that has been seen is actually anxiety and depression. So kids who are spending more time playing these games, they can be predisposed to other mental health disorders, and anxiety and depression is one of them.
I have a question. This is for Dr. Humera Chowdhary, and this is from a fellow physician, Dr. Rahman. And she says, as a primary care, we try to initiate counseling and medications, but what can we do to get patients seen quickly if you feel there's a need to be seen right away, or any guide?
That's a very good question. Actually, I was going to bring up that concern that many times what I see is that primary care doctors and pediatricians, we are all trained in all specialties, but when we are identifying these symptoms and depression, there are places like sometimes I know there are not a lot of child psychiatrists in the area, and I would say sometimes we are not available right away. There has been sometimes a wait. You can send them to Children's Medical Center or places like they have screening. There have been places in the community. Most of the hospitals, they have free assessment centers, which don't even charge, but if you are concerned, you can get at least some kind of assessment. However, any of my colleagues, like Dr. Mariam mentioned, practices in Arlington, and she sent a patient to me in Frisco. And Mariam met me in a social gathering, and she said, I want you to see this person. I said, Mariam, they will never come to me. How would I be able to help them? And I can't believe Mariam convinced them that they have to come see me, and I saw them. So I think communication send directly with us, any of us, Mehvish, Afrina, Mehvish and Sabeen, we are all available. If you guys can send us a progress note, send us a referral, so we know a little bit of what the child is dealing with, and we will be happy to take care of that when we will evaluate the person who needs help.
I have a question now for Dr. Mehvish, and this is how to deal with a child who manipulates or threatens parents with threat of suicide if parents do not give him a new car or allow him to be outside at all times. Parents have been approached by neighbors and friends, but they refuse to acknowledge that there's a problem. So what to do if a child is manipulative or threatening of suicide? What is a parent's role in that case?
I think, threat of suicide is something that really just cannot be taken lightly. And I think, having done inpatient and day program for a while, we do come across kids who, for reasons of avoiding school or avoiding things,
Can we ask the audience to mute yourself, please? Go ahead, Dr. Afrina.
So I think, I don't want to kind of give a message out there that, anytime the kid says that, mentions about suicide, that parents come back and think that it's a way of manipulation. And sometimes teenagers attempt and succeed because they want to get back at their parents. The impulsivity is what puts teenager at high risk of completed suicide. They have a reason and they think it's end of the world, and that's what makes them attend. So suicidality is something that I can't give the message that, you know what, you can take that lightly. So I think, I mean, if you are in a situation where your child has done that repeatedly, you've kind of made sure that they're safe, you've gotten them assessment, and after that, I think it finally comes down to really communication, being able to connect to that child, being able to connect in a way to try to find out reasons, try to validate what they're feeling, and really, family therapy, I think, would be good place to kind of really resolve some of these issues.
There's another question. Obviously, there is a stigma of the parents not seeking help. And there's a question about, what if I want to seek help for my child, but my child, who's a teenager, does not want to go for counseling or go see a psychiatrist? What should be the parent's approach in that situation? And I'll send this question to Dr. Lubna.
I think this goes back to the same thing which I started in the beginning, that you have to be connected and involved in your child's life. And that's why I was kind of pointing more on, it's one key factor. If from the very beginning you are involved with your child, you are connected to them with early years, you can openly communicate with them on every issue. You let them express themselves. They give them the reassurance, like Dr. Humera also said, give them the reassurance of love and acceptance. If that connection is built early in life, it goes along all the years, whether it's a middle school, senior school, or college. It just starts all at the beginning. And that's why I'd emphasize so much on it. And I would kind of emphasize and say, this is my take-home message, that you have to build a connection, a very strong relationship with your child. And that starts early years in life.
I would also
add another question.
Beautifully. I would like to add also that, I believe the child is a product of nature and nurture. So yes, every child is born with the genetic makeup, with the inheritance and all that. But then we parents play tremendous role in raising that child. The community, the whole family plays a huge role in raising that child. What does that child see? And children are very sensitive. They are very intelligent. They are very sensitive to the surroundings. Some parents feel like, okay, the husband and wife are fighting, but the child doesn't know. The dad is drinking, but the child doesn't know. Mom has this problem, but the child. So those are all myths and they are false. So we have to, where Dr. Lubna Kamal mentioned, that we have to have that connection with the child. And sometimes, parents misunderstand that, yes, it's very easy for us to say. I would like to say that we are sitting as doctors, we are saying these things. Believe me, it's very easy to say, but when you have to do it, it's not easy. But all of us are parents, we are all mothers, and we have our own challenges. But you have to take a step, you have to change your mindset that we have to connect with these children. Younger children, this generation, there is a generation gap. These children, we are raising them here in different culture, different exposures. So we have to be able to connect to their level.
And I would add as a parent that yes, it is difficult. It is difficult. We all come from different countries with different cultures. And it's a culture clash in this country. It's hard for us to accept. And of course, with our children, they grew up over here. Sometimes I feel our children are reading double lives. They have a different world outside and a different world inside the house. So really, it again comes to that basic connection, basic relationship, just the comfort and the reassurance to the child that they can come and express and talk anything with their parents. A parent is a child's best advocate. We need to let them know from the very beginning. We don't want them to seek help outside. They should come to us.
And Lubna, I will add another thing that I know this is on most of the parents' minds, that many parents ask, how do I address this issue? Like, I know, how do I address drugs? How do I address sexual identity? How do I address depression? They all come under the same umbrella that if we are comfortable, if our child is comfortable, to talk to us, they will come to us. Another thing I would say, don't wait for the child to bring that conversation. Make your house like a environment where you are all talking freely. It's an easy, comfortable environment where anybody can share their opinion without being judged, without being criticized. So have a positive household. My mom used to be big on, when our children were little, my mom would say, talk to them and tell them little stories. I still remember that. At that time, I didn't understand that, Mom, I don't have time. I'm doing my residency. I'm doing this. I don't have time to tell them stories. Now it clicks that mom wanted them to hear stories of your childhood, stories of anything, any positive examples, little lessons. And even if you go home today and tell your children, when you went to Niagara Fall, what did you do? When you went to visit wherever you went, when you went to Dallas downtown, what did you do? They love to hear those little stories because that's when families connect the most. Have your guards down and connect to them.
And be like not judgmental.
One thing I would like to add, which I tell, to all the parents of the kids that I see, I always tell them, there are 24 hours in a day. And out of the 24 hours, if you can just take out 5 minutes or 10 minutes each day, or maybe, every other day, but just talk to your child, how the day was, who are your friends, get to know their friends. That's very, very important.
Right.
Get to know their friends, what they're doing, get to know their hobbies, their interests. So it doesn't take much. All it takes is like 5 minutes to 10 minutes in a day. That is it. And then you will know a lot about what's happening in the kid's life. And many times what I see is parents, they don't have time. So that's the biggest thing. And the child knows, oh, my mom will not listen, or my mom is so busy, or my dad is so busy, and they just feel, okay, there's no one to help. So it's very important. Taking out 5 minutes out of your 24 hours is not much for your own child.
Mariam, I would just like to add one more thing. Really, from the experiences in my practice, I have been seeing some of her patients from our background where the dad was working all day and the mom was home all day. She was doing household work. And when I would ask her that your children are by themselves after school, and the dad would say, my wife is home all day. And she was home all day, practically doing work, but she did not have that quality time to spend that child, which, like Dr. Sabeen Riaz said, even if it is 10 to 15 minutes, that matters. So being home all day doesn't matter. You have to take out the quality 15 minutes, sit with them 1:1. And yet
That somebody
I
asked a
would add on
question.
that, Lubna, that is what I usually tell my patients. And sometimes they look at you like you have been talking in some foreign language.
Right.
And I would take it to general population. It is not only any culture, any community. It is for like every population. All the parents who are from different race, different countries, they have this dilemma. Even the Caucasian population who are native here, the same dilemma, because that is the age when husband, wife, they are busy, they are making their life, they think they're doing everything right. But the child cherishes when I remember I told one of my patients, and I have been doing it more often. I told because I used to do that with my daughter, I would sit on the floor, we would have a tea party. We would have a pretend friend and my daughter and me, and sitting on the floor, it's a tea party, a pretend playing home. And she used to enjoy it. So I told my patient to do that. She looked at me like, what a stupid idea. But then when next time she came, she said she did it and she cannot believe how much information she got from her child.
Right.
So these are the kind of creative ideas you have to figure out. For each child is different. Each child is different. My youngest daughter, when she was 10 or 11, she came to me one day and she goes, Mom, can you teach me knitting? I'm like, you sure? Like other kids have not asked. She said, Mom, teach me knitting. That would be our bonding time. I'm like, my child's psychiatry, I'm like, okay, you want bonding time? Let's do something. So these are the kind of little things, non-expensive things, right. No money involved, just quality time.
Quality time, yeah, that's the key.
One thing I like to add is, if as a parent, you think you cannot help your child, like there was a question about the suicidality. So in that case, in case of any suicidalities or any homicidal ideations, I advise the parents seek help. So the immediate resource is 911, period. Nothing else, call 911 if you are thinking your child is going through some kind of emergency and then you cannot handle it.
And Sabeen, I will take it to the next level. I was recently asked by a child who is 22-year-old. Somebody approached me from the community that they are depressed, but they would not go to the doctor. So again, I would raise another issue that in these kind of situations, please, please, please do not compromise the safety. It's your brother or sister or child or your friend's child, whoever it is. My request to teachers, pediatricians, primary care, us child psychiatrists, community members, if you see anybody in danger, any family member or a caretaker can file mental health warrant. It's very simple. You call the police, and if the patient does not want voluntary treatment, there are ways to get the help. It sounds very serious, but believe me, it works. You get the help that you need when your child or your loved one does not want to go get the help, but they are suffering.
There's another question: how to have communication with a teenager who doesn't talk much? I would say the answer to that is just sit with them and wait for them to say something. Most of the time, just sometimes quiet. Some people can be alone and they're not lonely. And some people can be lonely while they're surrounded by people. So it's very important to spend quality time, whether it's you just sitting parallel with your 18-year-old or your 17-year-old and you're both reading a book, but spend time together. Spontaneous hugs.
And then
patting someone on the back, showing physical kindness, asking them how their day was. Be ready to listen, be available emotionally and physically as much as you can. Now we're showing some resources. I hope you can see the resources for mental health.
Mariam, I just wanted to add, and the reassurance to these teenagers about the love and acceptance. This is what they want.
But 369 there be
one more thing I want to add. I think we have mentioned it before in a comorbidity list, but I want to pay a little bit more attention to that, and I want everybody to be aware of it, because many times we see these children who are loners. They are alone. They rather play video games. Not every child who is playing video game has mental illness. However, that is a very safe platform for them to hide from everybody, go play video games. You don't have to socially interact with anybody. You don't have to read anybody's body language. You don't have to be empathic to anybody. You are just sitting in front of the machine doing whatever you please to. So please pay attention. Many times these children who are doing these, I have noticed they have underlying autism disorder, which many times have gone undiagnosed. And I'm amazed by seeing that. And I have seen one 15-year-old, one 14-year-old, and one 16-year-old. And the why they came under my care were all three of them. It amazed me during last month that they had threatened to kill their parents and the siblings and threatened to kill themselves. You look at them, you talk to them, you can see this is autism. They do not have any connection. They have no remorse. Their mind is not capable of making the connection of how serious is what they are saying. So awareness for autism is it is not there. We have to be aware. There are lots of children who are autistic and they're not diagnosed.
Very good point. And I think one more point that I want to make is that know their virtual friends. I think it's very important for parents to know their friends physically, but also know what kind of groups they are getting into. And there are a lot of groups out there that encourage, there's a group called ANA, Pro ANA, which encourages anorexia. So young teenage girls to starve, giving them ideas about cutting and all that. So know what is it that they're looking at and watching online.
Very good point, Mehvish.
I think again, it is social media supervision.
Right.
that should continue.
Right.
So social media, I would just summarize the social media doesn't have any problem. It's a great resource, but the age, the filter, the understanding, like, you know, if there is a little child who had no other exposure and he's sitting on social media without any control or without any parental supervision, God knows what he is watching. So all that, and even the selection of video games. I'm very big on selecting video games. If you let your child play killing video game, that killing and blood will become a normal to the child.
Right.
So it's no brainer. We have to be careful. One more thing I would add, I think it has been bothering me that we all feel like, you know, I'm hearing these questions and again, that we, I think as parents come to a point where I'm sensing that we are scared of our children. I would urge you, please, please, please do not be scared of your child. Your child needs help, be available, be their confidant, be their supporter, be their advocate, make that strength, do whatever to gain your strength to be able to help them. Sometimes we might not have that strength which our child needs help with. So please
Absolutely.
seek out help for yourself. Like we were talking about pregnant women giving birth to a child, we like depressed women. I'm talking globally, like everywhere, the huge responsibility is on mother and father. And again, I'm not being, you know, promoting any gender, but basically, no matter which culture you look at, even animal kingdom you look at, mother's job is to raise the child, father's job is to go earn the food for the children.
Right.
So mothers, you have to be strong. You need support from the husband. You need support from the family. You need support. And you have to be aware of your weaknesses and your strengths. So to help your child, you have to be stronger. Remember when we sit in the plane, we have to take the oxygen mask first before we give it to the child. So we cannot be a good mother, good parent, if we are having lack of oxygen and we are suffocated and we are suffering.
Right.
So that takes it to another level.
Another
that was an
question, which
important-
I think that has kind of made us aware of something. I hope that everyone can look at the resources that is showing. We will have a video of a recording of this program, which will be available on our site for you to be able to see, and hopefully your children can see it as well. For anything that we could have missed. There is a question which I think we all thought of it in our head. This was a good program and they wish that this could happen often. And can it happen often? I will let Dr. Lubna Kamal, who's the president of our board, say what does she think and what was her take on how often do we need to do this, and how can we help the community be a little bit more involved in this topic, which seems to be something that seems to be on everyone's mind and seems to be very much needed at this point.
Mariam, you know, our American Muslim Women Physicians group is there to help the community. That is really our main and mission. If people are liking this and they need help, and especially I would say it is time, we have felt that ourselves also, that we need to offer our services more often. People have liked it, and I do promise, I guess, with the permission of all my participants, that we will soon be doing this kind of program again. I hope that makes everybody happy. And I would like to thank all the participants who were there, and also all the speakers. May Allah bless and reward all of you. Jazakallahu khairan.
Thank you very much. Thank you very much for everybody's time.
Thank you.
Thank you so much.
Thank you so much.
Remember,
And
I would just like to add one more thing, Mariam. I want to let the people know about our website, AMWPA.org.
and this program will be available. It would be recorded and it would be available, right, Dr. Lubna?
Yes, Humera.
Jazakallah khairan, everybody. Assalamu alaikum wa rahmatullah.
Thank you very much.
Assalamu alaikum and good night.
Good night.
Thank you.
Good night. Thank you.
Thank you.
Thank you.
Very informative.
Thank you.
Subhanakallahumma wa bihamdika ashhadu an la